Hello, my name is EmilyAnn Duffley, and I am a second-year AUD student at Northwestern University. Currently, I'm serving as the teaching assistant for the Pediatric Audiology course, and I just thought it would be nice if I could share what I am presenting in that course on this platform. I'm going to share my screen. So today I'll be discussing the latest pediatric hearing aids. I'll be starting by talking about the Phonak products, then moving on to Oticon, and wrapping up with ear molds. Currently, the Phonak product line is in transition from their Marvel platform to their Paradise platform. And when hearing aid manufacturers launch a line, they typically give access to the products as they become user ready. So right now, all of the adult products are in the Paradise line, but those pediatric products haven't come out yet. And the best they have available at the moment is a part of the Marvel line. And I'm recording this in the summer of 2021, so that could change at any time. And those Phonak Marvel products go by the name Sky Marvel. They come in fun colors and 3 technology levels, and they also have indicator lights to help communicate with parents. And this may not seem like a big deal that the hearing aid can flash when it's not working right. But if you have a little baby who doesn't yet have the speaking ability to tell their parents that their hearing aid's not working, this could be the make or break feature that allows the child to communicate with the parents about whether or not the device is working. So that little light could make a big difference for a young listener. And these hearing aids also have universal connectivity, meaning that they can connect to any device that has YouTube, or not YouTube, that has Bluetooth. And you can also get a rechargeable battery or a disposable battery for any of these products, except for the superpower device, and that's the loudest one. That one only comes in the disposable battery option at the moment. And one of my favorite things about the Phonak line is that their Roger products, or their remote microphones, currently do not require a boot on the hearing aid. They just stream directly to it, so you're only dealing with 2 pieces, the hearing aid and the Roger mic, not 3. These are our Phonak Sky Marvel fitting ranges, and what the fitting ranges tell you is whether or not a certain hearing aid is appropriate for a certain child. If you put a child's audiogram onto this fitting range and it's in the gray, that means that that child qualifies to wear that hearing aid. And one thing that you'll notice is as we move from left to right across the screen, the hearing aids get a little bit bigger. And as they get bigger, the amount of amplification that they can offer gets louder. So the bigger devices offer the loudest amplification for the most severe hearing losses. Another thing that's great about Phonak is they have an option for bimodal users, or children who have a hearing aid on one side and a cochlear implant on the other. This option is possible because of their partnership with Advanced Bionics cochlear implants. And now that there is this partnership, the Advanced Bionics CIs and the Phonak hearing aids are able to talk to one another. And the best thing about this is that when our bimodal users stream, now they can hear that streamed signal through both devices, which is huge. Because before this partnership happened, if you had a bimodal user, meaning a person who had a CI on one side and a hearing aid on the other, and they wanted to stream a phone call, they would have to pick, do I want to hear this phone call through my CI or through my hearing aid? They couldn't do both. But now with this partnership, they can hear through both ears at the same time, even with that streamed signal. And this is huge because that means they can use both sides of their brain to process the sound in the streamed signal, making it easier to understand. Another great thing about this partnership is now the new Advanced Bionics programming software looks a lot like the Phonak hearing aid software. So it makes it easier for hearing aid providers or audiologists who are used to Phonak to navigate advanced bionics. Now, I know this is a pediatric presentation, but I just wanted to mention that there is one adult product that may be suitable for certain children with a very profound hearing loss. And that product is the Phonak Power, or Phonak Paradise Dash Ultra Power. And what's unique about this new product is that it is able to fit up to 120 dB even at the low frequencies. And I just want to go back to our previous slide and show that the loudest pediatric hearing aid currently only goes up to 110 dB at those low frequencies, not to 120. So if you have a child who needs maximum amplification, you can give them this device. This would also be great for someone with a progressive hearing loss where you're not sure how severe their hearing loss is going to get. It connects to the Phonak Junior App, just like all the other pediatric hearing aids. It only comes in adult colors, but that's not the biggest deal in the world. And like the Phonak Sky Superpower, this device only comes in the disposable battery option. Another thing that's kind of cool about the Paradise line of hearing aids that just came out is that they offer multiple Bluetooth connections, meaning that you can be listening to your TV through your hearing aids, and then if you get a phone call, that sound can stream to your ears and you won't lose the connection to your TV. It could hold both Bluetooth connections simultaneously. And this is a picture of the icon for the Phonak Junior app, and it's compatible with all the hearing aids I've talked about today. This app allows parents to track the wear time of their children, check the status of their devices, change the settings, and contact remote support. And by remote support, I mean you, the audiologist. It allows you to have like a FaceTime call with your patient, and in addition to just the talking face-to-face, you can change your pediatric patient's hearing aid settings remotely. So that is a great feature. And this is the Roger On device. And it, like I talked about earlier, the Roger device is a microphone that helps children hear in difficult, noisy listening situations. The product works in 3 different modes. Mode 1 is the pointing mode, where you can hold the microphone up to someone who's talking and it'll help their voice be louder than the background noise. The second option is the presenting mode, where if you're in like a lecture hall or a classroom, that teacher can wear the device around their neck and the hearing aid user will be able to hear their voice as if they were standing right next to them, as opposed to sitting in the back of the lecture hall. And the third and final mode is table mode. That's when you put the Roger On device flat on a table in a group setting with people sitting all the way around the table. And the device is able to zoom in on whoever's speaking and pick up their voice better than the hearing aid user would be able to hear it without the Roger there. Again, there's no boot needed to use the Roger, and the microphone orientation no longer matters. So if you have a presenter who's a rookie with Roger devices and they accidentally put it upside down, doesn't matter. The child will still be able to hear the teacher no matter what, because it has multiple microphones now. Okay, let's move on to our Oticon devices. Here we have our Oticon Open Play behind the ear power device, and the fitting range is here in the upper right hand corner. Just like the Phonak device, it has indicator flashing lights. You can see one of the lights here, and that helps the parents to know whether or not the hearing aids are working correctly. It's compatible with iPhone, but not Android. And it also has a Corda MIDI fit option, which is just a skinnier tube than the standard 13. And that could be good if you have a teenager who wants something more discreet. These devices still require boots, though, if you're going to use them with an FM system. So that's a little bit of a downside. And they're suitable for all ages. There is also no rechargeable option for any of the power levels, whereas Phonak offers it for most power levels. Here are the Oticon Open Play mini receiver and ear devices. They could be rechargeable or disposable battery operated, and they are only suitable for responsible teenagers. And I really want to stress that. Never ever put this device on a child or a little baby, because the RICs, they have sensitive electronics sitting in the ear canal unprotected with no casing. So if your kid is chewing on their hearing aid or throwing it across the room because they don't know any better, then the device will likely break and it'll likely be expensive to repair it over and over again. So we only want to give it to teenagers who recognize how delicate they are and are responsible enough to take good care of them. And the power of these devices is dependent not on the hearing aid itself, but rather on the strength of the receiver wire. These RICs, they come in pediatric colors as well as adult colors, so it gives your teens a lot of options to pick from, and they are only iPhone compatible, not Android. Here's the Oticon Power BTE Super Power / Ultra Power devices. Both of them are pictured here, and the Ultra Power device is slightly bigger than the Super Power device because it amplifies slightly louder. Here is the fitting range for the Ultra Power. It goes up to 120 dB. And here's the fitting range for the Super Power device. It goes up to 110 dB. These devices are iPhone only compatible. They need the boot just like the other Oticon devices for that FM or mic signal, and there is no rechargeable option. Only disposable batteries can be used. Here is the Oticon Connect clip, and this is similar to the Roger On device in that it's a little microphone that you can give to a speaker in a difficult listening environment to increase the speech to noise ratio. One great place to use this would be like in a car, because the speaker is facing typically away from the child in the back seat looking at the road, and with this you can have the child be able to hear the voice as if they were sitting right up next to their parent. So that's pretty cool. And the Oticon Connect clip, the orientation of the device does still matter, so it takes some training for somebody to use it properly. But it has great research behind it and really does help children in those difficult listening scenarios, just like the Roger On. I just wanted to mention that while Oticon doesn't have a pediatrics app, their general app called Oticon On does work with their pediatric hearing aids, and it can do all the same things that the Phonak app does for parents and kids to operate the devices through a phone. Now we're going to move on to ear molds. So, the bread and butter of pediatric ear molds is the full shell silicone ear mold, and it's pictured up here in a patriotic color scheme. And we like these ear molds because 1, they're really soft and comfortable for the kids. 2, they reduce feedback. And 3, they have good retention. We need these kids to be wearing the hearing aids during all waking hours, so that retention is super imperative. We usually only do an acrylic material in place of the silicone if you have a little patient with chronic drainage issues, and we prefer the acrylic for chronic drainage because they are easier to disinfect. Make sure that if you are fitting a hearing aid on a little guy with a little ear, that you request a pediatric ear hook. In the upper left-hand corner here, I have the adult ear hook shown on the left and the pediatric ear hook on the right. This could be very important for retention as well. And it's not standard, so make sure you ask for it if you want it. Something that is different about ear molds for kids versus adults is that they are constantly being replaced because the child's ear canal and ear in general are growing. And when their ear is growing, but the ear mold is not, it's becoming too small, that means that feedback can happen. So we are replacing these actually every 1 to 2 months for our tiniest patients that are in that newborn to 1 year age range. As the kids get older and the growth slows down, you usually only need to replace them about every 3 to 4 months, but it's still way more than adults. So it's important to be really good at those deep ear mold impressions because it's a huge part of the job. I also just wanted to mention that skeleton molds are an option for older kids, and they may prefer that because unlike the standard full shell, it only fills up part of the concha. Here are the pediatric tubing options that are available. Just like with adults, you can use that standard 13 tubing in most scenarios, and the tubing lock is great to help improve retention. But if you have a tiny infant with a tiny ear canal and this 13 tubing won't fit, you can always go to the 13 to 16 tubing, which is just a little bit smaller for the part that's inside the ear canal to make sure that you get a good fit. If you prefer to work without the lock and use glue, you can always do that as well, and that's pictured right here on the right-hand side. Venting in pediatric ear molds. Okay, so when you are with a little baby, typically you don't put a vent in that ear mold because there is no space. But as the child ages and their ear canal becomes bigger, you have more space to put a vent. And if it's appropriate for their hearing loss, I say go for it because it'll reduce the occlusion effect. But we have to remember that not all pediatric hearing losses are appropriate for a vent because vents allow low frequency sounds to pass through the ear canal unamplified. And if your child doesn't have good enough low frequency hearing for that type of listening situation, they do not need a vent. It won't help them. It's important to avoid the reverse horn effect, which is when you have something that's decreasing the size of your tube or your vent at closest to the eardrum. And what that does is it dampens your high frequency sounds. Lastly, it's important to be cautious about using feedback suppression because feedback suppression, if you use it, it could also dampen those high frequency sounds to stop the hearing aids from squealing. And with adults, this isn't a huge issue because adults know what language is supposed to sound like. So if they are missing a couple of plural S's here and there, it's not going to destroy their language development. But with kids, it's a bigger deal. So we need to make sure that we're doing everything we can to keep that high frequency information available to our young language learners. It's better to use feedback cancellation than feedback suppression because it does not affect the high frequency amplification. Here are some resources in case you want to go over anything I mentioned today in more detail. And thank you so much for your time and attention.